Since in traditional old-fashioned bunion surgery, the bone was simply cut off the side of the bunion and the bone was not realigned, the bunion did have a chance to return. With the newer advanced tricorrectional bunionectomy that we perform at Vancouver Podiatry, the bone is cut and shifted into the foot using one single screw to hold the bone in place, which then aligns the joint straight and ensures that the bunion will not return as the deforming force is removed. As you can see here in the picture of an 8-year post-op bunion surgery, not only is the toe straight, but the tendon going over the toe that pulls the toe is now straight and aligned, ensuring that the toe will be pulled straight and removing the deforming force.